Stigma. There's been, since we've recorded history, people who act strangely, aberrantly, hear voices. This raises in other people the fear, well, maybe that could be myself. And I don't want to be around people who are going to bring me down. On the other hand, stigma can be overcome. One in four people currently are experiencing a moderate to severe mental illness.
Digest that. Roughly 82 million people in the US have a mental health challenge and are not all getting the care they need. What is the federal government doing? In 1996, the federal government passed the Mental Health Parity Act, designed to make mental health coverage equal physical health coverage. In 2008, the law was updated to the Mental Health Parity and Addiction Equity Act in order to close any loopholes.
It offers essential health benefits, so insurance companies can't discriminate between maternity care and prescription drug coverage, emergency room treatment. They have to provide that to you now.
But many loopholes still exist. Enforcement is still lacking.
So stigma means literally both the sharp sticks or rods used to burn a brand into a person and that brand or mark. Stigma prevents people from seeking help. Stigma prevents the right funding to get people the treatments they need.
If half of all people living with cancer had no treatment in the previous year, we would be outraged. And the fact that over half of our country is living with mental health conditions, going without treatment, that's truly outrageous.
In Santa Clara County, California, almost 2/3 of people have reported stigma.
The reality is about 96% of all children in California are covered, but a very, very small percentage who need it actually get access to care.
It's almost 1 in 4 people in the United States get Medicaid coverage. It is hard to use those benefits to access many psychologists, psychiatrists, and substance use places. And those providers of mental health care who do see Medicare or Medicaid are overwhelmed.
Currently, half of Santa Clara County does not know about mental health care options.
When you're between 8 and 18 years old, you go to the doctor the least. But that's when 75% of mental illness manifests. Historically, in the mental health system, you've had to meet what are called diagnostic criteria. I think there's a really important role for the federal government, and that's to help redefine how young people could qualify for support.
The importance of provider networks. The most important need that I've seen is just to have more mental health professionals available for people to work with, so they're not just taking private pay from relatively affluent people.
We have to have a full continuum of services available so that people aren't forced to wait to crisis before they get care.
Within Santa Clara County, the biggest obstacles are the lack of knowledge, cost, and complexity.
There's federal and some state parity laws on the books now, but the enforcement isn't good. There's loopholes big enough to drive a truck through. Getting funding levels for the National Institute of Mental Health parallel with the levels for the National Cancer Institute.
We should require that health plans invest in a minimum set of services to support the health and welfare of children, particularly the social and emotional health and welfare of young people.
On the other hand, these well-known federal mental health policies are still thriving. Among these positives are the steady increases in education, the promotion of mental health awareness, and the boost in care. Overall, the pandemic has beat us down, and after spending more than a year studying the mental health of my school and local community, I found the unpredictability of the current pandemic has spread feelings of isolation, lack of motivation, and anxiety. People have lost their jobs, struggled with distance learning, and have become socially anxious after months of shelter in place. This pandemic hasn't just killed, but also crippled the mental state of most people.
I think we have to think more in terms of what are we doing as a culture to make it so difficult to be a young person? In the last 20 years, suicide has leapfrogged cancer and car accidents as a cause of death. That's one of the biggest reasons we have to pull mental health out of the medical model.
Yet there is still hope. CHAC is a local nonprofit centered around improving mental health.
For CHAC, all our school-based services are no cost, but we are a family services agency. So one of the things that we are really focused on doing is providing more access to family therapy support. And we have a sliding scale.
Our schools are the foundation for change in achieving a stigma-free nation.
It can include, from one end of the spectrum, sort of a preventative piece, helping them express their feelings. And it can go to more individualized support, where you're going in and you're talking to a counselor about your experience. It could be group support.
In doing my research and searching for interviewees in Santa Clara County, I found the stigma was so strong that I couldn't find any students whose parents would allow them to be interviewed, even anonymously. People should feel safe to share their feelings. It's a step towards achieving parity. There are currently 3 new Senate bills in play that require each state to identify a mental health education plan before January 2024. But will these bills be enforced properly?
Look inside you. It's not a sign of weakness, but of strength to open up. It's great when people can connect. And if we can do that more and more, we may be on our way to a much more stigma-free society. And it's people of your age and generation who are going to make the difference. So keep at it.